What I would tell a general provider about women with chronic pelvic pain is do not underestimate the impact that pelvic pain can have on a woman's quality of life and function. It's a very complex and often multifactorial problem that affects their daily activities, that affects their relationships. Many of these women have not only daily pain, but pain with intercourse, pain with other daily functions such as urination and bowel movements. And the causes of the pain are often multifactorial. I think these women need to be supported, and I think that they need to have a provider that is well versed in all the different potential causes of pain so that they can put together a treatment plan that is individualized for their actual causes, for their individual experience. The prevalence of dysmenorrhea, so how frequently women report pain with periods, is not very well studied. In the epidemiologic data that I quoted earlier today, the question in these studies was asking a general population, do you have pain with your periods? Up to 90% of women report that they have some pain with their periods. If you try to narrow it down to the percent of women that have pain that's severe enough that it affects their ability to work or to carry out their usual activities, then that number is much lower and probably somewhere between 10 and 25%. So it is an incredibly common phenomenon, and that threshold as to when that pain is severe enough that it shouldn't be considered normal is a difficult question to answer. It was one of the questions that an insightful audience member had asked me, and what I would say is that I think anyone that has pain with their periods should certainly try simple things like nonsteroidal anti-inflammatories and or Tylenol, and if that is not helpful and the pain is affecting their quality of life, then that is enough pain that I would say warrants evaluation. We're not always going to find an anatomic cause for that pain, but it doesn't mean that that pain can't be treated. And there are a lot of effective options out there that I think women just don't recognize can be helpful to them. Well, supposed to or not supposed to is, it's common for it to hurt, but it shouldn't have to hurt, and women don't need to live that way. We have a lot of effective and safe treatments that should be readily available to women no matter what their prior experiences are, what their access to medical care is, and it should be more aggressively treated and managed because most women that end up having chronic daily pain, when you ask them, they've often will say that their pain began as just pain with their periods. And I think while this hasn't been studied well enough, many experts I think rightly believe that if we can prevent and treat that cyclic pain early, maybe we can prevent many of those women transitioning into daily pain.